Welcome to our video presentation on tips for caregivers when caring for residents with a mental illness. We hope you find this information helpful. Today, we will be discussing the following: how to talk to a resident about mental illness, communication strategies, things not to say to someone with a mental illness, specialized certification, person-centered planning / individual plans of services / behavior treatment plans, and caregiving tips. Let's get started. Let's discuss how to talk to a resident about mental illness. Talking to the resident about their mental illness can help them feel less alone and more supported. Be present and available to support them. Plan the conversation in advance. Try to pick the best time and place for the resident to have the conversation. Be patient and non-judgmental. Offer support, but be clear about what you can and can't do to help. And remember that the person is more than their mental illness. Remind them who they are and what they enjoy. This can help them separate their identity from their mental illness. Let the resident share as much or as little as they want. Don't pressure them to tell you anything that they don't want to talk about. Don't diagnose or second-guess their feelings. You probably aren't a medical professional or counselor, so don't make assumptions or try to diagnose them. Keep questions open-ended. Give the person time to answer and try not to ask too many questions. Talk about self-care. And listen carefully to what they tell you. Repeat what they said back to them to make sure that you understood it. We will now go over some of the communication strategies when talking with someone who has a mental illness. Maintain an open posture. This includes not crossing your arms. Crossing your arms can be taken as an unwillingness to listen. Maintain a comfortable level of eye contact. Standing too close can increase discomfort. Some people with paranoia may be frightened, so be aware that they may need more body space than you. Keep personal space between yourself and residents. Maintain normal tone and pitch when speaking. Pay attention to the words you use. Be specific and concrete, but avoid oversimplifying. This can seem patronizing. Be respectful. When someone feels respected and heard, they are more likely to be respectful in return. If they are experiencing hallucinations, be aware that these hallucinations are their reality. Communicate that you understand that they experience these events, but don't pretend that you experience them. Don't assume that they are not smart and will believe anything you tell them. Don't lie to them, as it will break any rapport you might want to establish. Don't pass them on to another person just to get rid of them. Anyone who is passed unnecessarily from one person to another can become angry or violent. Refer them to someone else only if appropriate. Set limits if needed. These can include things such as, "I only have 5 minutes to talk to you right now," etc. Call for help if you feel physically threatened or need help de-escalating the person. When communicating with residents with a mental illness, residents should be treated with dignity and respect. They should be treated with esteem, honor, and politeness. Residents should be addressed in a manner that is not patronizing or condescending, be treated as equals, and be treated the way any other individual would like to be treated. Residents should also be treated with concern, consideration, and appreciation. The following are some examples of treating residents with dignity and respect. Calling a person by their preferred name, using preferred gendered pronouns, knocking on a closed door before entering, using positive language, encouraging the person to make choices instead of making assumptions about what they want, taking the person's opinion seriously, including the person in conversations, and finally, allowing the person to do things independently or try new things. We will now go over some of the things not to say to someone who has a mental illness. First, get busy and distract yourself. Distractions won't work, not even temporarily. Don't you want to get better? This implies the person is staying sick on purpose. Change your attitude. A change in perspective can be helpful, but it won't cure conditions such as ADHD, bipolar disorder, PTSD, or schizophrenia. Stop focusing on the bad stuff and just start living. This can make a person feel worse about themselves. You have everything you need to get better. This sounds like an indictment for not trying hard enough, and it might not even be true. You can snap out of it. Everyone feels this way. Everyone experiences a range of emotions, but not everyone experiences depression. Just pray about it. This advice alone can minimize the problem and ignore medical and psychological treatments that are proven. Why can't you work? Telling a person who is already struggling that they are lazy, just making excuses, or not trying hard enough can be incredibly hurtful. And finally, you have the same illness as my fill in the blank. Many adults with a severe and persistent mental illness who require close supervision, treatment, and/or supports 24 hours a day and are not able to be supported in a lesser restrictive environment live in AFC facilities that hold a special certification to provide services to residents with a mental illness and contract with at least one CMH agency. Prior to placement of a resident in an AFC with a special certification, the CMH provider will coordinate with AFC staff members to make sure they understand the requirements for specialized residential services. They will also ensure that the home is familiar with and is compliant with home and community-based services standards. Person-centered planning, or PCP, with CMH enables these residents to identify and achieve their personal goals. PCP is required by state and federal law as a way that individuals receiving services and supports from the CMH system plan how those supports are going to enable them to achieve their life goals. It is an individualized process designed to respond to the unique needs and desires of each person. Residents receiving services from a CMH agency will develop an individual plan of services, or IPOS, through the PCP process. Direct care staff in AFC facilities with residents who have an IPOS are required to receive training on each individual's IPOS and any/all ancillary plans or recommendations, such as sensory diet plans from the OT, special dietary plans, or range of motion plans. Documentation of IPOS training must include, at a minimum, the staff name, the date of the training, the trainer's name and title, and the topic of the training, such as IPOS for Jane Doe, dated 9/30/2015. If a resident's mental illness involves behaviors that they or others who work with them want to change, their IPOS may include a plan that talks about the behavior. This plan is often called a behavior treatment plan. A behavior treatment plan is developed, approved, and reviewed regularly by a team of specialists to make sure that it is effective and dignified and continues to meet the person's needs. Special Certification Rule ending in 806 Subrule 1 indicates that CMH plans of services, which include IPOS and behavior treatment plans, shall be implemented for residents residing in the facility. Direct care staff are to follow the individualized guidelines indicated in these plans when providing care to residents with a mental illness diagnosis. Next, let's discuss some caregiving tips for people who have a mental illness. First, get educated. Learn about mental health. Ask open-ended questions about their feelings, such as, how does it feel? What makes it worse? When do you feel good? Etc. As you become more knowledgeable, you'll be more prepared to help them. Learn common side effects of medications. Encourage treatment. Encourage the resident to seek treatment if possible. Give freedom and empower the resident. Allow the resident to take control of their own lives, and allow the resident to make their own decisions. Be friendly. If they want to talk, listen. Laugh with them, enjoy time with them, etc. And set boundaries to protect yourself. Take care of yourself. Get enough sleep and exercise. Take time for yourself, and get help if you need it, such as going to a therapist, counselor, support group, etc. Avoid helicoptering. This is a form of over-involvement in care. Residents can feel that they are under constant surveillance for an episode or adverse event. Over-involvement and anticipation of worst-case scenario can feel suffocating, disempowering, discouraging, and even enraging. Practice positive reinforcement. Recognize and praise accomplishments. Don't mistake a depressed person's inactivity as laziness. Show compassion for past mistakes. Always convey empathy and compassion. Focus on the present moment and future goals, as many people with mental illness may often obsess over their past regrets and mistakes. Don't buy into the stigma. Separate the illness from the person. Throw away your own preconceptions and false beliefs about mental illness. Understand confusing behavior. Don't assume that behavior is conscious and deliberate. Focus on larger goals. If you get upset, remind yourself what the long-term goals are. Pursuing larger goals doesn't mean burying your feelings. It means communicating your more important feelings well. And finally, expect decent behavior. Tell residents about the standards they need to meet so that they can live well together. Here on this screen are some resources you can check out to learn more about caring for residents with a mental illness. Thank you for watching our video presentation on caring for residents with a mental illness. As always, resident safety is our top priority,